Well, I want to start by thanking the 471 participants who have registered for this webinar. Many people are joining in, and we expect to even have a larger number before the end of the webinar. Now we're going to start by reading the citation of the lead speaker, Dr. Femi Oke-Osonyitolu. Dr. Femi Oke-Osonyitolu was born on 15th of October 1968. He graduated as a doctor from the University of Ilorin in 1991, after which he proceeded to General Hospital Ikeja for his house job between 1991 and 1992. He did his youth service at Agege local government. He then became a medical officer at Bagada General Hospital from 1990 at Bagada General Hospital. From 1994 to 1998, he became a medical officer at the Bagada General Hospital also, after which he became a senior medical officer at LASEMS in Lasut, Ikeja, between 1998 and 2001. In 2001, he was appointed the head of Lasambos, and he was the head of Lasambos from 2001 to 2005. Between 2005 and 2006, Dr. Femi Oke-Osonyitolu was made the head of the Lagos State Emergency Management Agency, LASEMA. From 2016 to 2017, he was appointed as a senior advisor for monitoring and evaluation on IDP program at the presidency. From 2017 to 2019, he was also a senior technical advisor on disaster risk management, also at the presidency. From June 2019 till date, he was made the DG and Chief Executive Officer of the Lagos State Emergency Management Agency, LASEMA. Dr. Femi Osonyitolu has many achievements. Some of his achievements are Pioneer Doctor of IFACO Primary Healthcare in Lagos State, Pioneer Member, Lagos State Emergency Services, Pioneer Head of Lagos State Ambulance Services, Pioneer General Manager and Disaster Manager for Lagos State, the Arrowhead of doctors responsible for the evacuation of Lagos State government patients for overseas treatments. He was the Disaster Manager and Coordinator of state response during Ebola outbreak in Lagos State. He was the team leader in emergency response to the bomb blast disaster that occurred in Lagos State in 2001. He coordinated the state response in managing more than 20,000 major and minor disasters in the states and other states, including Ogun State, Edo State, Oyo State, and Borno State, such as the Dana plane crash, the associated plane crash, collapsed buildings such as synagogue building collapse, fire incident disaster in Ijegun, Abule Egba pipeline vandalization fire disaster, flood disaster in Oyo State, 3-story building collapse in Ogun State, road traffic accident in Lagos State, Ogun State, Borno State, and flood disaster in Edo State, Okobaba fire disaster in Lagos State, major flood disaster and train crash in Lagos State. He was a team member in conceptualization and development of 3-digit emergency number in Lagos State. He was a member in the conceptualization and development of Command Control Center in Lagos State. He is a member and in the conceptualization and development team of the first Bonds Center in Nigeria, which is located at Bagada General Hospital in Lagos State. He was part of the team that conceptualized and developed the relief camp for victims of disasters in Lagos State. He was the chief camp commandant for the IDPs that were associated with the flood disaster in Lagos State in 2010. 1,600 IDPs were camped for more than 11 months at that camp. He was a team member in the conceptualization and development of Lagos State Response Plan, Contingency Plan, and syllabus for emergency and disaster management in Lagos State. He has been on many ad hoc and standing committees and he has been involved in various important emergency and disaster management projects, such as development of National Public Health Emergency Contingency Plan. He was the best doctor at Lagos State Emergency Medical Services in year 2000. He got a commendation award for management of disaster by His Excellency, the Governor of Lagos State in 2002. And he was the best and the most proactive state emergency management agency in Nigeria, Lasema Pioneer, under his leadership in 2010. Dr. Femi Oke Osonyitolu is a member of many professional bodies, including the Medical and Dental Council of Nigeria. He's a member of Executive Secretaries of State Emergency Management Agency Forum. He's a member of International Disaster Managers, and is a member of the Emergency Planner of the United Kingdom. Dr. Femi Oke Osonyitolu has many hobbies, which include playing table tennis, lawn tennis, and golf. Due to connection problems, we cannot connect to him at the moment. We would have to take the Executive Secretary of the ES to start off the presentations, after which we would hopefully take on Dr. Osonyitolu. Ladies and gentlemen, I present to you the Executive Secretary, Lagos State Blood Transfusion Services, Dr. Mrs. Her name gone off my head at the moment. Dr. Oshikumaya. I apologize for that, please.
Good morning, everybody. Dr. Osonyitolu is presently trying to connect with us. His presentation is here, but we're finding it difficult to get him to talk. So I will start the presentation from my hand. I'm sorry for the slight disruption. So I'll be talking about the emergency preparedness in the blood transfusion service. And I am Dr. Bodunmi Oshikumaya, the Executive Secretary of Lagos State Blood Transfusion Service. I'm very happy to have you all here again for our quarterly webinar. This is going to be last of the series of webinars we've had this year. It's been a very, very wonderful time since we started. It's been quite interactive. We have had an opportunity to improve our services from this webinar. We have had an opportunity to improve our services during this webinar. We've also been able to create a lot of policies with respect to inputs and from other people. We have had an opportunity to collaborate with others. We've had opportunities to partner based on the webinar that we started this year. So back to the major thing in this webinar. What is the role of the blood transfusion service in its emergency preparedness? So the objectives of this webinar is to sensitize and orientate health authorities and blood bank personnel to the identification of their responsibilities, the functions of the blood bank services in disasters, and using this to take an opportunity to take account the priorities needed and the needs of those in the blood bank with respect to our preparedness during emergencies, as well as how to get local capacity for an immediate response. So in emergencies, there are three aspects of the laboratory that are very, very important. The first is the public health laboratories. We need to be sure that there is diagnosis confirmation of communicable diseases with high mortality rates. If you look at the last two epidemics that we had, the epidemic and the pandemic, we had to ensure that the Lagos Biobank had the ability to confirm and to diagnose all these communicable diseases. When it comes to the clinical laboratories, the clinical laboratories must have the basic tests available for those that are in need of it. And with respect to the blood bank, there must be first availability of blood, and this blood must be timely provided. And you should please note that in disasters or in emergencies, the blood transfusion service, which is the referral center, is the institution that is designated to organize this emergency plan as well as coordinate actions to be taken by the blood banks and the donor center networks. So what is involvement of the blood bank in a disaster? So a blood bank can be involved when there is a sudden increase for a need for blood that cannot be met locally. For example, something happens around, maybe there was an accident and about 100 people need blood in that vicinity. That is a disaster because there is a sudden need for blood and it cannot be met locally at that time. Also, a blood bank is in a disaster if there's a sudden significant limitation to the ability to collect, test, process, or transport blood or specimens. For example, let's assume there was an earthquake and we are unable to collect blood from the place it was being screened to the place it's being needed. It becomes a disaster to us. And the third thing is if there's a disruption in communication related to blood needs. A facility needs blood and you are unable to communicate with anybody to know the needs, to know the availability, and to know how the blood will get there. It becomes a disaster to the blood transfusion service. So when can all these things happen? For example, natural disasters, earthquakes, fires, weathers, and floods. And if it could also be human generated when we have mass shootings, when there are road traffic accidents, during acts of terrorism, fires, emergence of contagious diseases, and when there is civil unrest. So what is our goal during a disaster? The first and the most important thing during a disaster is to ensure that there is communication. Who do we want to communicate with? The Lagos Blood Transfusion Center, which is the referral center, should be able to communicate with other blood banks. Should communicate with the private blood banks. We have 118 private blood banks, and we have 28 public blood banks registered under the Lagos Blood Transfusion Service. Also, we must be able to communicate between the disaster sites as well as the hospital, whereby the closest hospital is, must be in good communication to where the disaster is happening. We should have very good communication between the logistics service and the blood bank. There are times when we need to take the blood to another center, and there are sets of people that usually do this. So there must be good communication between them. And finally, if it's within the same facility, there must be good communication between the accident and emergency and the blood bank of that hospital. The second goal of a blood bank during emergencies or disasters is to ensure that there is collaboration between the states, between the federal, between the private and other agencies. We must establish a network of these blood centers. So our first collaboration is our parent body, which is the National Blood Service Commission. Must be able to collaborate with them. There are different regions. We have the Ibadan region, which is the south, we have the southwest, we have the central, we have the northwest and the northeast. So we also should be in good collaboration with the blood banks in the state's general hospitals, the blood banks in the Lagos State University Teaching Hospital, the private blood banks that are licensed under BTS, that is the Lagos Blood Transfusion Service. We must be in good collaboration, must collaborate with the federal health institutions. And majorly that is the Lagos University Teaching Hospital. Then we must be in good collaboration with emergency organizations like Red Cross of Nigeria, and as well as voluntary blood donors and related organizations like COP25, HIMA, Lifesavers, and other organizations. So this is the way the Lagos Blood Transfusion Service stands out amongst its stakeholders. So we have the blood logistic facilities, we have the private blood banks, the public blood banks. We have the state healthcare facilities, the screening centers, and over 80 stakeholders. The third goal of the blood bank during disaster is to ensure that there is adequate transportation of blood and specimens. Blood must get where it is needed at the right time without causing shortages elsewhere. So who does the transportation? You can start from the healthcare workers. If it's within the facility, then you should be able to ensure that all health workers that are available can transport blood and specimens where it is needed. And then we need to involve the healthcare technology and logistic companies. And under the Lagos State Blood Transfusion Service, we have the Life Bank Nigeria and Qatar Briggs Limited, who have been very, very instrumental in ensuring that people that need blood get it at the right time within the shortest possible time frame. So when there is crisis, so many words come to us. I really love this particular graphics because every word here points towards the urgency, meeting the needs. So we can see the crisis, disaster, there's rescue there's property, there's public, there's private, there are natural disasters, there's ambulance, there's a threat, there's a situation there, and there is preparedness. What we are here to talk about is our preparedness in the disasters. So what is the Lagos State Blood Transfusion Service preparedness? So the first is to establish, based on the principles by the World Health Organization, the first is to establish a state reference blood bank to coordinate operations. So the Lagos State Blood Transfusion Service Bagada Center is the state reference blood bank which coordinates the operation. So when there is an emergency, the first place where decisions are made will be the headquarters, which is at the Bagada, which is within Bagada General Hospital. We are to provide a blood bank or alternative health services with technical managerial capacities, which is similar to that of the reference blood bank. And this is also available at the Lagos State Blood Transfusion Service. We have one of our centers at the 5th of Lagos Island Maternity Hospital, which has a similar capacity as that with the headquarters, which is at Bagada right now. And within the next few weeks, we'll have another center that is being built up to have similar managerial capacity at the Lagos State University Teaching Hospital. These two centers are actually central, one for the mainland and the other one which is closer to the island. We need to organize communication systems of the blood banks. The Lagos State Blood Transfusion Service has got closed user group lines, that's CUG lines in all the state blood banks and all screening centers, so that there could be good communication without the thought of having to recharge the phone or saying that we're unable to communicate with others. So there's a closed user group line for all state blood banks and screening centers. We also have, we collaborate with the private blood banks through the Blood Bank Society of Nigeria. So once there is a disaster or there is a dire need for blood, we have a communication channel between the Blood Bank Society of Nigeria and Lagos chapter will help us to ensure that we get blood in the right places. And the third thing is that we have an open channel of collaboration between the National Blood Service Commission and the federal system here, that is Lagos University Teaching Hospital. The next thing is to define mechanisms for emergency transfusion management in disaster-affected area, taking into account higher demands. There will definitely be higher demands. There will be a reduced capacity to provide these services, and there is a need to alternate these local sites to absorb these demands. So one of the ways to take into account these high demands is to have telephone assistance. So we have got multiple contact numbers for facilities. Apart from the closed user group lines from the blood banks, which was issued from Lagos State Blood Transfusion Service, the Health Service Commission also provided closed user group lines to the state hospital. So there are multiple numbers to contact any health facility. The blood collection under the Blood Transfusion Service does not depend on the staffs of Lagos State government only. We have in multiple times engaged volunteers to assist so that when there is an upsurge in our blood collection activities, these volunteers can always be co-opted to come back to assist. They have been trained, they have the experience that is needed to collect blood. When it comes to screening of blood, it is compulsory that every unit of blood, irrespective of the disaster, should be screened for the transfusion transmissible infectious agents. All units of all screening centers have a capacity to screen daily. That is from Mondays to Fridays. And there is one center that screens over the weekend. So at each point in the state, there is a screening center that has a capacity to screen blood. That shows that at each point in time, we can get safe blood for anybody that needs it. Blood component preparation is available in 3 centers in the state, and this blood that is collected is separated to the appropriate components, and there is a very buoyant transportation logistical support that can be used to take all these components and the red cells to where they are needed. So each hospital have got ambulances, both the private, both public hospitals, even the blood banks have their own ambulance services, as well as bike services to be able to transport blood from one place to another. We also have logistic companies that can do that. And we have hospital staffs that can be put on the road to get blood in times of their emergencies. The other thing that the Lagos Blood Transfusion Service does is that we try to collect blood in accordance with needs. Right now, the need for blood is much more than that which is collected. So the blood collection continues. We organize the transportation of blood and blood components to the affected areas using the already licensed blood logistic companies. And finally, we try to organize drills. With respect to this, the Lagos State Blood Transfusion Service will be organizing drills all through the month of November. All interested parties, at least a representative from each state hospital and each private hospital is required to be a part of this simulation. When the emergency happens, what do we do? The first thing is to assess the need for blood. This brings the Itafagi events into play. During the Itafagi event, the first thing we thought of was there was a huge need for blood. And by the time we assessed the need for blood, we realized that there really was no need for blood at that time. So the first thing is to assess the need for blood. You have to obtain information from the people that are close to these events. You need to know the nature of these events. You need to understand that where the blood needs come from. So where do we get all this information from? Social media. We need to be very close to what is being said at the social media. We need to be very close to what is being said in the news media. We need to understand what is happening in hospitals and the blood banks. I need to get information from family and friends. They will call into the center and they will call into the center requesting for blood, sending soft copies of all the requests from their respective centers. The second thing we need to do is to take inventory. What is the available units? We need to know the available units. We need to know if they can be available for immediate release. Is the blood available now? Has it been screened? Is it within the recommended time usage? What type of components do we have? Do we have adequate platelets? Do we have adequate fresh frozen plasma? So you need to determine this inventory first before we start making demands to the community. Because once there is a disaster and an appeal is made to the community, there's a possibility that more panic will be generated, much more than the emergency already entails. So there'll be an increase in the number of voluntary blood donors. How do we treat these voluntary blood donors? The first rule is not to send any voluntary blood donor away. They are there to help. They believe that that is the best way they can help those that are in danger. So the first thing is to counsel them, is to put them at ease and begin to prepare to collect. So blood, if there are too many blood donors at that time, we can send the blood donors to other centers that are not congested. The second thing is to prioritize who you collect blood from, because everybody comes and everybody would want to give blood irrespective of the risk factors that they have. So we should prioritize to receive blood from people that have previously donated. So if you have been a regular blood donor, that will be our priority in collecting blood. And the last thing is to bleed these donors as soon as possible, because they'll be coming in their large numbers. So you do not want them to pull together, forming a crowd there. So you bleed the voluntary donors as soon as possible. And if they are not voluntary donors, before they leave, you encourage them and you counsel them to become regular voluntary donors. Blood must be collected in accordance of the standards in any country. So in Nigeria, for each unit of blood that is collected, it must go through the screening test. That is the 4 transfusion transmissible infectious agents that we check for: HIV 1 and 2, hepatitis B, hepatitis C, and syphilis. All units of blood must be grouped for the APO and rhesus groups. They must also have a component separation. That is what we do here. Once the blood comes in the Lagos State Blood Transfusion Service, because we know that all blood must not be wasted, each unit of blood that is collected is appropriately separated for those that require it. And then there must be an approved product release during transfusion. Just because there's an emergency doesn't mean that every unit of blood that is requested must be given. We must ensure that it is approved before it is transfused. And as necessary, we should mobilize skilled health workers who are trained to collect blood. Due to the high demand for blood, it is possible that we will be unable to meet the capacity of the present healthcare workers, might be unable to meet the present demand. So we should mobilize skilled healthcare workers from the surrounding, from the hospitals around. This has been done in recent times. When the need arises, we are able to call on to healthcare workers, blood bankers, other healthcare workers to come into the Lagos State Blood Transfusion Service to assist to ensure that the needs are met. Immediately the emergency is met, it doesn't end there. We need to understand, we need to assess the compliance of the policies that we have created, the compliance of the emergency plans that we have put into place. And if there is poor compliance with some of those things, with respect to the standard operating procedures that have been created, or with respect to the protocols that have been done, then we need to take appropriate corrective action, because there will always be emergencies, there will always be disasters. These corrective actions are not to discourage people if the mistake has been made or if they have not fully complied to the existing plan. It is to be able to strengthen the existing service. So the second thing is to collect data. We need to collect data and evaluate. What really did we do? What did we do right? What must have gone wrong? So examples of data and evaluation that we do is to ascertain the number of units that was given out with respect to numbers requested. Recently, we had an emergency, and because we are afraid that we are given an impression that the blood loss was quite much, we sent about 8 units of blood to that particular center. At the end of the day, by the time the doctors reviewed, we realized that only 2 units were actually used. So we saved the life of the person, but during that period, we tried to assess, because it is an emergency, we might not be able to determine the cold chain of the blood or the blood products during that period. So these are the reasons why we know. So we need to also know the number of units dispatched and that transfused. So these are things that we need to know. So it helps us to also get the minimum ordering schedules and compare the minimum ordering schedules of a particular condition to that which is actually used in real time. Another thing that we should know is the number of discarded units. Blood can be discarded for whatever reason. Blood might be discarded at the time of transfusion. They might have seen the blood clot there because the blood would have been collected in a hurry. If there's a possibility too that while the blood is being collected, it was not collected in a full bag. Maybe a donor has got a small vein. Every unit of blood that is discarded during this period must be assessed and reviewed to know the reasons for the discard, so that such reasons are taken into consideration when another form of emergency occurs. The last thing is we need to replace the stock. What have we used up? What supplies? How many units of blood bags have we used during that short period? How much, what volume of reagents were used? What budget was put in meeting up with that emergencies? We must replace the stock in preparation for another emergency. And then we will review the inventory use. During emergencies, there's a possibility for wastage to come up because we are trying to meet the needs. Wastage in terms of reagent, wastage in terms of manpower, wastage in terms of finances. All these things must be reviewed and well assessed. And finally, for everybody that has come to donate, we must reach out back to the community. This is an important, it's good enough to talk about different forms of emergency transfusion management protocols. When there is a disaster, it is said that you make hay while the sun shines. Before we can bring up a disaster management, then protocols must have been protocols. So when there is a lot of blood loss, that is the time to activate a massive transfusion protocol. What is massive transfusion protocol? This is a transfusion of at least 10 units of blood within 24 hours, or the patient's blood volume within 24 hours, or greater than 4 units of blood within an hour, with an ongoing need for transfusion, especially in children greater than 40 mils per kilogram. It also refers to rapid transfusion of large amounts of blood. So once there is life-threatening hemorrhage, we can request for blood in a ratio of 1:1:1, so that we manage the hemorrhagic shock that might occur and prevent the patient from being steeped into complications such as coagulopathy. So when we talk about the ratio 1:1:1, that's the ratio of red cells to the ratio of platelet concentrates to the ratio of fresh frozen plasma. In the emergency obstetric packs that we have, once a mother or once a pregnant woman begins to bleed, we request for at least 6 units of packed red cells with 6 units of platelet concentrates with 6 units of fresh frozen plasma. This is the ideal request in the massive transfusion protocol. Another policy that comes up during the emergency transfusion management is the ABO typing policies. When there is dire emergencies or when there is a disaster, the least you could do is do an ABO. That is to check for the blood group A, B, or O. Once you check for this and it is compatible with the patient's blood group, then you would be required to transfuse. You could extend the extended typing, that is extended grouping and cross matching. If you need to do a grouping and a cross match, an emergency cross match is adequate. And we encourage use of O negative red cells or group AB plasma, because these have no antibodies and they have less transfusion reactions. There is a policy on emergency blood release during disasters, which is available at the Lagos Blood Transfusion Service. When there is a disaster, when there is a request for blood, the first unit of blood that we give is to give an O negative uncross-matched cells, at least for the first unit, to save the patient's life. So this is requested for when the transfusion is required immediately before any form of testing can take place. So you do not know the blood group of the patient, you do not know anything about the patient, but you need to give the patient blood at that time. So the first thing is to give the O negative uncross-matched red cells. This will save the life of the patient. Then blood samples can be taken for subsequent tests before the administration of more blood. After this, if there is a little bit of time to run the patient's test, you could give a group compatible on cross-matched blood. For example, the patient is A positive and is bleeding excessively. We can give the patient A positive red cells even before a full cross-match is done. So you give the patient a group compatible uncross-matched cells, and then blood is taken for subsequent cross-match. Emergency full cross-match takes about 15 to 30 minutes. This can be done after the patient's life has been saved with first, maybe a universal donor O negative cells, or if you have had an opportunity to repeat the donor's blood group, a group compatible uncross-matched cells. During emergencies, please be wary of taking what the patient has said as correct. For example, what I mean is, if a patient comes to you, is bleeding, and he or she tells you his or her own blood group, please be wary of taking into records that particular group given to you verbally, unless a blood test has been done to confirm what the patient has said. So this is a summary of the emergency blood release. The first thing is, once there's an immediate need for blood, you give O negative. You don't need to cross-match. You don't need to check the blood type of the patient. All you need to do is to confirm that the blood that is going to be given is O negative. If the blood need is between 10 to 30 minutes from the time the request has been made, you can go ahead to take the patient's group. So you can take the patient's blood to determine the group, as well as to determine the group of the blood you want to give, and give a group-specific unit of blood without an initial cross-match. Once that is given for the first unit, you will continue doing the cross-match so that the healthcare personnel can have a result to ensure that the blood is compatible with the patient's own. If the need for blood is greater than 30 minutes, then you must do a cross-match and give the patient a group compatible unit. So this is an emergency schedule of the blood that can be given during disaster. So the first is an O negative blood. It can be given to everybody, all blood groups, irrespective of what you have. That's the first thing you can give. If the O negative units are not available, then you must think of giving an O positive unit, which can be given to every other person. If you have the opportunity, once there's an opportunity to check the patient's blood group, then you give a group compatible unit while a cross match is going on. And if the need for blood is more than 30 minutes, then you must do a complete cross match before transfusion. In summary, for you to be able to have a complete preparedness during disaster, there must be protocols. You must, the policies of the blood bank must be included in the state health emergencies policies too, so that there will be an wholesome approach during the disaster management. You must have regular emergency drills. As I said earlier on, all through the month of November, every Tuesday during the month of November has been dedicated to have emergency drills in the Lagos Blood Transfusion Service headquarters. These drills will be spread to the other state hospitals as well as the private hospitals, so that we can prepare for emergencies now that there is none. You must continue to have effective training on the simplest of things, that is grouping. Emergency training on effective grouping during emergencies. Trainings on effective grouping when you do not feel you have the capacity to do it. Training on effective grouping when you are stressed out and you're unable to, it might be difficult for you to make the right decisions. So all these things will be simulated during the emergency drills. Also, training on effective cross-match must be done so that during emergencies, you do not give the wrong units of blood to those that require it. They must encourage adequate stock of blood by increasing the number of voluntary blood donors through a good retention program. Donating once voluntary does not make you a voluntary blood donor. By WHO, you must have donated at least 12 times in 1 year for us to call you a regular voluntary blood donor. So, and all these things can be done when you have a good retention program. So we need to keep a list of available manpower. As I said, when the need or the demand increases, we might need to call in skilled personnel from different facilities. So we must have the contact list of personnel professionals that stay around different regions in the state. Based on, like in Lagos, the Bile centers, the 5 administrative controls must have numbers of eligible personnel that can work during disasters in a database so that we can communicate with them. And this, not just their numbers, we need their addresses, because there might be situations where we need to pick them from their homes to help during emergencies. And we must have their specialties. What do they do? What is their capacity? Also, we need to continue to keep a database of rare blood types. This is available, both are available in Lagos State Blood Transfusion Service. So we have our database of rare blood types that we can call in during emergencies, especially those with rhesus negatives. Only about 20% of people, of Nigerians, are rhesus negative. So it becomes a rare blood type, especially during emergencies. So in conclusion, one of the principal problems in detecting interventions or instituting preventive measures, especially during disasters, is lack of basic information. The objective of this presentation is to enlighten us and to have basic information of what is expected of you, what is expected of the Lagos State Blood Transfusion Service, and what is expected of me during disasters. And also the response of health services to disaster situations will be greatly improved if it will be greatly improved if our plans are incorporated in each hospital emergencies plan or the national emergency plan. Thank you for your attention.
Thank you very much, ES Dr. Shikomaya, for that wonderful presentation. We won't be taking questions now. We'll take questions later. We'll answer the questions later. Dr. Oke Osanyitolu, Dr. Femi Oke Osanyitolu is online now. We're going to take his resume again briefly, after which we'll take his presentation, and then we'll now take the questions and answers as they come. Dr. Femi Oke Osanyitolu was born on the 15th of October 1968. He graduated as a doctor from the University of Ilorin in 1991, after which he proceeded to General Hospital Ikeja for his house job between 1991 and 1992. He did his youth service at Agege local government area. He then became a medical officer at Bagada General Hospital from 1994 to 1998, after which he became a senior medical officer at LASEMS in Lasut, Ikeja between 1998 and 2001. He was made head of Lasambos from 2001 to 2005. From 2005 to 2016, he became the general manager of Lagos State Emergency Management Agency. From 2016 to 2017, he was an advisor monitoring and evaluation at the IDP program at the presidency. Also in 2017 to 2019, he was a senior technical advisor at the presidency on disaster and risk management. From June 2019 to date, he was appointed the Director General and the Chief Executive Officer of the Lagos State Emergency Management Agency. He has many achievements, and some of his major achievements are he was a pioneer doctor at the Fakor Primary Healthcare Center in Lagos State. He was a pioneer member of the Lagos State Emergency Services. He was a pioneer head of the Lagos State Ambulance Services. He was also the pioneer general manager and disaster manager of Lagos State. He was the arrowhead of doctors responsible for the evacuation of Lagos State government patients for overseas treatments. He was the disaster manager and coordinator of the state response during the Ebola outbreak in Lagos State. He was the team lead in emergency response to the bomb blast disaster that occurred in Lagos State in 2001. He coordinated the state response in managing more than 20,000 major and minor disasters in the state and other states, including Ogun State, Edo State, Oyo State, and Borno State. Such disasters as the Dana plane crash, the Associate plane crash, collapsed building such as the synagogue building collapse, fire disaster in Ijegun in Lagos State, Abule Egba pipeline disaster, and other disasters like that. He was the team lead in the conceptualization and development of the 3-digit emergency number in Lagos State. He was and has been an ad hoc and standing, and he has been a member of many ad hoc and standing committees involved in various important emergency and disaster management projects in the state. He was the best doctor in Lagos State Emergency Medical Services in the year 2000. He got a commendation award for management of disaster by His Excellency, the Governor of Lagos State in 2002. And he got the best and most proactive Lagos State Emergency Management Agency in Nigeria in 2010. Dr. Femi Osonyitolu is a member of the Medical and Dental Council of Nigeria, a member of Emergency Planners of the UK, and member of International Disaster Managers. He has many hobbies, including playing table tennis, lawn tennis, and golf. Ladies and gentlemen, I present to you Dr. Olufemi Damilola Oke Osonyitolu.
Good afternoon, distinguished ladies and gentlemen.
Good afternoon, sir.
Good afternoon, distinguished ladies and gentlemen.
Good afternoon, sir.
Good afternoon, sir.
Good afternoon, sir. Welcome to our webinar, sir.
We can hear you, sir.
Yeah, I'm presenting role of healthcare facilities in emergency stroke disaster preparedness and response. The outline is what is disaster? Disaster management circle, disaster preparedness and response, current challenges, recommendations. When you are looking at what is a disaster, disaster is a serious disruption of the functioning of a community or society involving widespread human, material, economic, or environmental losses and impacts which exceed the ability of the affected community or society to cope with using its own resources. This definition is quite different from emergency. Emergency is a life-threatening issue, but the society or the community has the resources to cope with. Whereas in the case of disaster, the community or society cannot cope with using their own resources, they have to look for external people to assist them. When you are looking at disaster management cycle, we look at the response, planning, preparedness, mitigations, and the recovery aspects. Hello? Hello?
We can hear you,
We can
sir.
hear you, sir. Go on.
Okay. Now, phases of the disaster management cycle. Stages before a disaster, we'll talk about mitigation. Important in disaster-prone settings, reduce hazard and disaster impacts. Mitigation include public awareness, training, environmental and land use control. Then, secondly, you talk about preparedness to reduce the vulnerability and increase the local response and recovery capacity. Early warning, through warning system, risk assessment, contingency plan, public information, communication system, stockpiling designated shelters. Then stages after a disaster. These are what is going to happen when disaster or emergency has occurred. We first of all talk about response, immediate relief to save lives and prevent immediate loss of life. Search and rescue, medical care, food, safe drinking water, local first responders. High risk of mortality, short-term emergency services following a rapid onset disaster or during a slow onset emergency. Ongoing response to reduce vulnerability and meet basic needs, e.g., family tracing, food, nutrition, healthcare, watch, and shelter. Then we look at the recovery aspect, the long-term support in restoring normal life, local ownership and participation of critical to recovery, link humanitarian activity with longer-term development plans, rehabilitation, focus on public and social services, livelihood, education and changes to the disaster impacts, e.g., protection, reconstruction to re-establish the infrastructure, housing and pre-disaster services and social conditions. Disaster preparedness and response. Healthcare facilities are a critical element within the disaster response system and work collaboratively with governments and non-governmental organizations is to plan, prepare for, and respond to the needs of victims of natural or man-made disasters, bioterrorism, and other public health emergency. Hospital emergency preparedness is a priority to government at all levels, as well as a key focus of regulatory and accrediting agencies. The role of hospital in the community response to disaster has received increased attention, particularly since the Ikeja cantonment bomb blast incidents Hospital must be prepared to respond to and recover from all hazard, emergency, and disaster. These have been several initiatives to guide hospital role in these events and to assist hospitals in their efforts to prepare for them. To effectively prepare for disaster stroke emergency that ravage our community, healthcare facilities need to carry out the following preparedness activities: contingency planning, training, early warning, full warning system, risk assessments, public information, communication system, and stockpiling. Contingency plan. It is a management process that analyzes disaster risks and establish arrangements in advance to enable timely, effective, and appropriate response. Contingency plan results in organized and coordinated courses of action and clarity identify institutional roles and resources information process and operational arrangement for specific actors of times of need. Based on scenarios of possible emergency conditions or hazardous events, it allows key actors to envision, anticipate, and solve problems that can arise during disaster. Contingency plan is an important part of overall preparedness. Contingency plan needs to be regularly updated and exercised. Contingency plan is part of a cycle in which the identification and regular monitoring of risk, vulnerabilities, and capacities informs the planning and implementations of measures to mitigate the risk and prepare to respond. While each emergency is different in nature and context, there are many similarities so that common emergency management practice and policies can be built into the health system to create resilience. The key principles to bear in mind are that contingency plan should be practical, simple and easy to do, realistic and feasible, need-based and efficient, ensuring fair use of resources, process driving for effective operationalization, regularly tested through exercise, monitored and updated. Training, regular training and retraining of members of staff across all departments of facilities on content of the contingency plan. This training program will have a broad approach with both a critical and non-critical target audience that include, but is not limited to, hospital administrations, physicians, nurses, emergency care, technicians, safety, security, facilities, mental health, auxiliary, legal, risk management, human resources, education, clinic, and first receiver staff. Topic to be considered includes hospital surge capacity management for natural disaster and chemical, biological, radiological, nuclear, and explosive incidents, etc. Early warning system. An early warning system is a system of biological, technical, mature, deployed, and individual or ground to inform Different hazards require different early warning systems. The needs for the warning of human or hurricane, for example, are very different. Early warning systems are effective means of managing disaster. They are usually people conferred. They empower communities to prepare for and confront the power of natural hazard. The efficiency of early warning system is measured in terms of lives saved and reduction in losses. These are directly related to the executions of anticipated response by the healthcare facilities once a warning is issued. The availability of early warning system is very crucial to preparedness. The framework of early warning system consists of three phases: monitoring of precursors, forecasting of a probable event, and notification of a warning on alert should an event of catastrophic proportion take place. Healthcare facilities can effectively key into early warning activities through collaborations with emergency to disaster management organizations of the area, NASEMA for Lagos State. Communication, clear, accurate, and timely communication is necessary to ensure informed decision makers, effective collaborations and cooperations, and public awareness and trust. To effectively build the levels of preparedness and response, healthcare facilities should consider taking following actions: appointment of a public information spokesperson to coordinate hospitals, communication with public, the media, and health authorities, the extension of space for press conference outside the immediate proximity of the emergency department, triage, waiting areas, and the command control. Draft brief key messages for target audience, e.g. patients, staff, public, in preparation for the most likely disaster scenarios. Ensure that all communications to the public, media, staff in general, and health authorities are approved by incident commanders. Establish streamlined mechanism of information exchange between hospitals, administrations, departments, unit heads, and facility staff. Brief hospital staff on their roles and responsibility. Establish mechanism for the appropriate and timely collection. Ensure that all decisions related to patients, prioritization, e.g. adapted admission and discharge criteria. Ensure the availability of reliable and sustainable primary and backup communication system, e.g. satellite phones. Stockpiling, which is very, very important. Challenges that we need to quickly look into is lack of training, targeted of disaster management activities, equipment deficit, communication challenges, lack of interest and capacity, lack of adequate data on the state of emergency preparedness in the country, understanding local risks and vulnerability, maintaining and operating critical infrastructure. Being a long-term process, preparedness include often suffer from staff challenges, learning from the disaster and shortly, insufficient exercise to test and evaluate level of preparedness. Recommendations: strengthening existing healthcare facilities preparedness system through training of staff on basic disaster preparedness and response activities. Frequent with emergency management agency on simulation exercise to test existing system so as to improve on it. Improve on flexibility of services by changing of scope during certain disaster. Review of welfare activities to include mental health of healthcare workers and others first responders. Thank you very much for listening. I'm grateful. Thank you.
Thank you very much, sir, for this awesome presentation. I'm sorry I had to take your slot due to the connection. I'm really very happy to have you here. We are waiting for the questions to come up. We are really honored to have someone like you come to talk to us about the role of healthcare workers, especially the challenges. We also appreciate the fact that you mentioned training. Irrespective of the protocols and available, the place of training cannot be underestimated. When we have the protocols and training stroke drills or simulations are not done, we are not really able to implement the things, to know if we can implement what has been put in pen and paper, what people have discussed, and what we have decided to do during emergencies. So the role of trainings, the role of drills are actually top on the list of Lagos State Blood Transfusion Service, so that we can ensure that all that is being done in the healthcare system is actually worthwhile. Because irrespective of what the doctors, the nurses, and everybody does, if the need for blood is not met, that means that we really cannot work in tandem with each other. So thank you very much, sir. We are waiting for the questions. Once the questions come in, we will appreciate if you could kindly please answer. I understand that you are in an event right now, and we appreciate the sacrifice you've taken to please see us. So while we're waiting for the questions to come in, I have a question from Dr. Olatunji, past permanent secretary and one of the people that were instrumental in ensuring that the Lagos State Blood Transfusion Service is created. Our question is, what about the Armed Forces Blood Banks? Is the Lagos State Blood Transfusion Service in good working relationship with the ones in Lagos? Basically, we have not had an opportunity to actually strengthen the existing relationship, but the Armed Forces Blood Bank do come to our blood bank to collect blood when there is a need for it. It just stands to say that the Lagos State Blood Transfusion Service has a higher capacity to get more blood. So many people come to us to get blood. We have a stronger relationship with Lagos State University Teaching Hospital. That is when you talk about the blood banks outside the state health facilities. We'll do our best to collaborate more with more, including the armed forces, the military hospitals, as well as the National Orthopedic Hospital, so that we can collaborate more. That is the first question here. The second question is, someone asked if you could get the slide. All slides will be sent to your box within 24 hours of this webinar. The third question is it right to give blood without the patient sample, even in emergency situation? The first thing you need to do is to assess the need for blood. Is it an immediate need for blood? If it is an immediate need for blood and you have O negative, then you can give the patient that unit of blood whilst you run the test. So if there is no negative, then you must take the patient sample, do the grouping, and cross-match with the available units that you have So it all depends on the surrounding circumstances. So if there is a dire need for blood, there is an immediate need for blood, then you can give an O negative on-cross-match unit. If the need for blood is within a short time frame, maybe between 15 to 30 minutes, then you have the time to run the patient sample and do at least an emergency cross-match. And then if the need for blood takes about an hour, it's within an hour, then you should do the full cross-match and give the patient a good compatible blood. Thank you very much. We have other questions here. It says, Dr. Shukumaya, please emphasize this protocol. I need Dr. Shukumaya to emphasize this protocol in cases of disaster and not in hospital setting where the emergencies are expected or could be averted. So if the emergency could be averted, please do the right thing, do a complete cross-match. We are talking about disasters where there is a need for blood that the demand is quite difficult to meet up with, or when the patient's life is in danger. So if the patient's life is not in danger, then it's not a dire emergency, it's not a disaster. We should follow the ideal protocol. Another question here is, does the Lagos State Blood Transfusion Service have apheresis machine? Yes, the Lagos State Blood Transfusion Service have got one apheresis machine, which is presently located in at the mainland hospital. The machine, the apheresis system was donated to us by one of our partners during the COVID pandemic response. And we initially started using it to collect convalescent plasma, which was being used in a study to assess the efficacy of convalescent plasma in the management of patients with COVID-19. Right now, apheresis is being used to collect apheresis platelets for those who require. So if there's a need for apheresis products, you will have to make a request first. Apheresis products are not made and left for your request. This is because the consumables are quite expensive and we do not want any form of wastage. So when there is an emergency for the use of platelets, we give available fluids, which usually the platelets made from the cold centrifuge. So the single unit platelets are first offered while we get a donor to come on the apheresis system for the donation that is required. I don't know if there are any other questions. Thank you very much, sir. If you are still there, thank you very, very much, sir. I have a question from here on the paper here. One of the staff of the Lagos State Blood Transfusion Service would like to ask you, what is your experience with respect to blood usage in the emergencies that you have managed in time past, sir? Hello, sir. Dr. Okiosanito, are you still there, sir? Okay, I think the DG is not presently online. The question will be sent to him and the response will be given to us. We really want to know what his experience is with the blood transfusion service in the emergencies he has managed in time past. I have a question here too, a statement here. One of us is reminding us, of our relationship with the Police Hospital Falomor. So there is a blood bank at the Police Hospital Falomor that the Lagos State Blood Transfusion Service are the technical partners. So we're instrumental with the Rotary Club of Ikoyi, who got an international grant to expand the availability of safe blood in Lagos State. So a blood bank and voluntary blood donation center was established at the Police Hospital Falomor, and we have a very good collaboration and relationship with them. We encourage some of our donors to go there to donate, and we encourage them to retain the donors that come there. They give an excellent service, and they are one of our partners. As I've said before, somebody else from the military hospitals is also asking, as I've said before, we are here to strengthen our services. We will definitely strengthen our relationship with the military hospital as well as the Armed Force Hospital. Thank you very much. More questions are coming in. You said you separate the blood into various components. Please, how long do you store your packed cells? So our packed cells are stored for 35 days. We do not make it very packed, because if all the plasma is off, then we begin to have a problem of storage. So there is still quite some amount of plasma that helps us to store the packed cells for the usual 35 days. However, because of the their need for blood, most of the blood we get in the Lagos State Blood Transfusion Service does not even remain in our blood bank for up to 15 to 18 days. So the average usage time for the blood in the Lagos State Blood Transfusion Service is about 15 days. This is due to the high demand for blood when compared to the number of units that is donated. Another question here, regarding the capacity of Lagos State Blood Transfusion Service, on average, what volumes of blood components do we usually have in stock? So the volume of blood components dependent on the usage. Our fresh frozen plasma, because we have multiple centers now, the average stock of the fresh frozen plasma is at least 150 units at each point in time. The stock for platelets is usually minimal. We try not to produce so much platelets, except there is a pre-order, because the time limit for the average lifespan of a unit of platelets is 5 days. So there is a huge turnover for requests for platelets and the production too. For red cells, the stock of red cells we have is actually dependent on the demand. There are times when we have a lot of blood in the blood bank. That is when the need is not much during that, is not high during that period. But on the average, we actually do make use of an average of 100 units within 48 hours. We give out an average of 100 units within 48 hours in the Lagos State Blood Transfusion Service when it is available. Another question here is, you said O resus positive blood can be given out in the presence of O negative for immediate transfusion. What if the patient is actually the negative? Now, when we need to assess the clinical state. If a male comes in and I do not know the blood group, is actually O negative and is male, then you can give O positive blood. The reason why O negative unit is needed to be given to an O negative unit individual is when you have a woman of reproductive age group. So if a male comes in and is O negative, then the O positive is okay. If a woman comes in that is no longer of reproductive age group, you can still give the O positive blood. Now, the question is, a woman comes in, we don't know the blood group, is of reproductive age group, and needs blood dearly. You need to assess the life that you are trying to save with who you are trying to manage. The first thing you do for every case, irrespective of the sex, the gender, or the blood group, is to take the blood group for a test, and why you are trying to save that life. What is the relationship between Lagos State Blood Transfusion Service and the National Blood Service Commission? I can tell you that there is a collaboration between us. Myself and Dr. Amedu are in very good contact. Presently, Lagos State Blood Transfusion Service will even be in Abuja representing, trying to reactivate the Club 25. The National Blood Transfusion Service is the national body, and we do follow some of the policies that they put up to us. So we work with each other, we collaborate, we complement each other, and we are actually there for each other. Once there is a disaster, the first set of people that we send a message to is the National Blood Service Commission. The National Blood Service Commission also takes data from us every year. Everything we do here, we send the data to the National Blood Service Commission. So there is a huge collaboration between us. For everything we do, we give them feedback, they assess us, and they encourage us to do better. Please, our first speaker, what's the relationship between the professional regulatory bodies like MLSCN, that's Medical Lab Scientists Council of Nigeria. So the Lagos State Blood Transfusion Service is made of different professionals, majorly the Medical Lab Scientists of Nigeria. They are our key staffs. They man the blood banks. They are there working on the machine to ensure that there's blood components. So they are very, very instrumental. They are the people that actually the bedrock of the system. So we have a good relationship with them, they have a good relationship with us, and we work together to make sure that the vision of the Lagos State Blood Transfusion Service, as well as the vision of the Lagos State government, is established. Please, what is the age limit for platelet concentrates? I really don't understand the question, but if you are talking about for how long can a unit of platelet concentrates exist, is for 5 to 7 days. But in Lagos, the platelet concentrate has a 5-day lifespan. We have capped our lifespan for platelet concentrate to 5 days in this service, in the Lagos Blood Transfusion Service. How many times do we donate platelets in a year? So if you are donating apheresis platelets, that means if you are going on the apheresis machine for only platelet collection, you can donate a maximum of 24 units of platelets a year. But if you are donating whole blood for platelets to be collected using a cold centrifuge, then you can only donate between 3 to 4 times a year. This is because whole blood will be collected from you, and it is from that whole blood that the platelets will be separated. So it depends on the type of method we are using to collect platelets from you. Wow, these are a lot of questions here. So human resource is crucial. MLSN is crucial to workers. Beautiful, I agree. They have the bedrocks here. Majority of our staffs here are scientists, and they do an excellent job. What is the stand of Lagos State Blood Transfusion Service on direct walk-in donors between father and premature babies? We get this push by doctors. So our policy, the law of the Lagos State Blood Transfusion Service, says that every unit of blood must be screened for transfusion transmissible infectious agent. So when we do not support the walk-in donors, even if it's a blood volume, we make blood. We have 150 units blood here. We have 200 units blood here. We have 250 units blood here, and we have the 450 unit blood here. So we do not encourage such walk-in donors. It is possible that the parents will infect the children with any form of TTIs that the child does not have. It is wrong. You must not give blood that is unsafe, irrespective of the emergency. So get blood the right way that is safe and that is authorized for transfusion. After giving O negative blood to an A positive patient, can you give O positive blood or A positive afterwards? Beautiful, yes you can. O negative blood has no form of antibodies. It is the purest form of blood. It is wonderful, it is nice. So if you give O negative blood to an A positive patient, good. But subsequently, whatever units you want to give, you make sure that it is well cross-matched. O positive blood could have hemolysis in it. And there is really nothing like general donors again. For O negative, we feel safe because it has no form of antibodies in it. But for O positive, yeah, you must definitely do a cross match. Once you have done a cross match and it is safe and it's compatible for transfusion, then you can transfuse the blood. And the last question here, are we going to get the webinar recording? Well, is it possible to get the webinar recording, our ICT officer? Yes, I have been assured that the webinar recording will be sent to you. Thank you very much. There are lots of questions there, and I appreciate your input.
There's one other one here.
You have to continue. By text.
Okay. Thank you so much. Now we're having a short presentation, a goodwill message, a short goodwill message from Dr. Arogundade. He's the Medical Director of Lagos State Emergency Center at Tollgate, LASEC, and he's the co-chair of the State Emergency Medical Treatment Committee. I present Dr. Arogundade. Okay. Yeah, the next person. Mr. Okay, Dr. Arungdade seems not to be online at the moment. So we'll take the next goodwill message from Alhaji Tajuddin Olatunji, the Director, Medical Laboratory Services, HSC. Alhaji, are you there, sir?
Are you there, sir? Yes. Yes. Thank you. God bless you. Hello, can you hear me? Hello? Hello?
We can hear you, sir. Go on.
We can hear you, sir. Go on. Thank you. Let me first of all appreciate our two presenters for a very good presentation. In fact, I've learned so many new things from this webinar. Thank you very much for organizing this webinar. We're indeed very grateful. Blood is life, life is blood, and this underscores the importance of this workshop. The administration of saver blood and its components in modern medicine goes beyond just transfusion. It involves a process of selection, determination of fitness and suitability of donors, screening of such donors for basic acceptable health standards, and infectious agents, screening to ensure the safety and suitability of donated blood and its product, documentation and storage, and promptly making the products available when needed for transfusion. The above process essentially requires a team of health professionals. No wonder one of the themes of this workshop fundamentally resonates around the necessity of teamwork in the administration of safe blood. There is the need for health professionals to work as a team to achieve the goals and objectives of the present innovation being introduced by Lagos State Blood Transfusion Service. Clearly, as professionals in the business of provision of safe blood, we are here to meet up with the target of blood supply and usage in our various facilities. Therefore, all hands need to be on deck for this task to be surmounted. Recently, at the national level, consideration is being given to National Blood Transfusion Service to be upgraded to a commission. And in no distant future, we expect a similar turn of events in a dynamic state of excellence like Lagos. This surely will come with more responsibilities, and only a teamwork can see us through this challenge. So setting up, I also want to suggest setting up of an emergency blood and product transfusion units in all our facilities, which will improve emergency services. In conclusion, may I appeal to our amiable governor, Mr. Babajide Olushola Sanwo-Olu, through our ever energetic Honorable Commissioner for Health, to assist us in the area of human resource requirements to address the shortfall of manpower in our various facilities. So,
thank you, sir.
Thank you, sir. Yeah, thank you all for at least for listening. And we hope to get more of this in future. Very educative, very interesting, and it will go a long way in improving the services of people. Thank you. God bless you.
Thank you, sir.
Yeah.
Next, we will take the presentation, the Google message from Luke, Mr. Jimmy Adejare, who's talking on behalf of the Association of Medical Laboratory Scientists, Lagos State branch. He's a senior scientist at Luth. Mr. Adejare, are you there, sir? Mr. Adejare.
Hello. Hello.
Hey, Mr. Adejare.
Okay. Thank you very much, Mr. Oloko Okasha. I've been asked to give a goodwill message from Association of Medical Laboratory Scientists of Nigeria, Lagos State branch. On behalf of the chairman of the association, the entire profession in Lagos State actually really wish to appreciate the all-inclusiveness of the executive secretary in the operation of the blood bank. And he wants the state government and the commission to know that the association is always really willing at any point in time to partner with them towards ensuring that we deliver a good healthcare delivery service to our people and the good people of Lagos State. And we were saying that when it comes to an emergency, a lot of good work is being done by the blood bank, and he is of the view, just like Alhaji Olatunji said, that we should have all these emergency responses in all our hospitals and the centers, and that when we have an emergency, when we talk about emergency in the lab, the laboratory services, well, the laboratory scientists can actually be of use in two places. The emergency can be within the laboratory itself, and the emergency itself can be outside the laboratory itself, can be outside the laboratory. And the type of emergency that we are talking about can be like fire, disease outbreak, riots, flood, natural disaster, collapsed building, etc. And the response is not limited to the blood banking services alone, but to the entire, for it to be involved, the entire department of the laboratory. So we are actually appealing for training. That part of the requirement for this emergency response is actually training. People need to be trained on evacuation procedure. They need to be needed to be trained on communication during emergency, what to expect, where to call or look for information, how and when to use fire extinguisher, security issues, shelter in place, handling mail and phone calls, the laboratory protocols during emergencies, and the handling of violent behavior during emergency. Most especially, the laboratory personnel will also need to be trained on the first aid, CPR, and many other things that will be needed during the emergency. And also, there's supposed to be a need for provision of survival kit for emergency responders, especially the people in all the laboratory personnel. And the survival kit actually involved for the laboratory and for the individuals, as the individual laboratory personnel, that there's need for provision of such for them. Then they're supposed to be during emergency we are supposed to have preparedness for the SOP that will be used during emergency. That is the SOP for equipment calibration, handling protection, loss of damages, and the rest of that. Then SOP for sample collection, documentation, asset referral, transfusion, etc. Because this time around we are talking about something that is emergency, so it's out of routine, and there is need for actually organization like Mr. Olatunji said that there should be a coordinating center for emergencies in the laboratory, and then each laboratory should have an emergency response unit, and there should be coordination between the emergency team of Lagos State and the private labs that are nearby, such that in the case of emergency, there are information of which lab to contact immediately, most especially the laboratory that has been accredited. He wants to thank the Lagos State Emergency Services, most especially Lagos State Blood Transfusion Services, for a job well done for saving the life of our people. Thank you very much.
Okay.
So I'm done.
Okay, thank you so much, Mr. Adijare. Thank you, Mr. Adijare. We really appreciate you.
You're welcome. You're welcome.
Okay, now we have apologies from Dr. Arobundade, the MD of LASEC. He won't be able to join us now. And also Dr. Dr. Ismail Abdul Salam, who is the incident manager of COVID. He also apologizes for not being able to be part of this webinar. Who next now? Okay, now we're going to take another goodwill message from Mr. Fabumi Thomas, who is the chairman of the Blood Bank Society of Nigeria, Lagos State branch, the private arm of the blood bankers in Lagos State. Mr. Fabumi, are you there?
Yeah, hello, good afternoon. Hello, good afternoon. Can you hear me?
Yes, we can hear you, sir.
Okay. Yeah, thank you very much for giving us this opportunity. I want to first appreciate the privilege and deeply acknowledge the effort of the ES to ensure that blood transfusion services in Lagos State is done to the best of our ability. Well, just like the ES said earlier on, we have over 100+ private blood banks in Lagos. I am the chairman of the Blood Bank Society of Nigeria, Lagos State branch. And then I wish to say that we are ready to collaborate with the Blood Bank, Lagos State Blood Bank Transfusion Services to ensure that we are all prepared at all times to face any form of disaster that we may be faced with in future. We are talking about disaster preparedness. That is to know how well are we prepared, and also to probably get some things we need to know in case we are faced with such experience. The truth about it is that I want the authority to keep in mind that the Blood Bank Society of Nigeria is made up of a large personnel and facilities that banks blood daily. And we have the ability to do beyond what many people are looking at. So in the days or in terms of disaster, they should not just overlook or underrate what we can do as a people. Recently, there was an incident in Jos, and there is call for blood donation. There was a serious need of blood. The society, within 15 minutes, people, volunteers within us, were able to communicate with ourselves, and we got over 50 pints of blood. People were ready to give close to 50 pints of blood in a very short time. The problem we just had in that case was that, yes, the logistics of not transporting the blood from Lagos to Jos. And we liaise with the National Blood Transfusion Site. They say, well, the only thing they can do is let them liaise with some other states that are neighboring states and see how they can go about it. But if needs be, they will contact us. But that's just an instance to let you know that if the government will actually recognize us and appreciate the input we are putting into making sure that blood is available within Lagos, then let us know that at any point in time, if we are called upon, that's why there needs to be synergy, there needs to be cooperation within ourselves. If we are called upon at any time in the days of emergency, I can assure you that the Blood Bank Society members will rise to the occasion. I mean, we can donate, we have blood in our banks, so everybody can decide to give maybe one pound, 2 pints, and we quickly rush it to the area to help. And if that is done, I know that things will be well. Again, I want to quickly just let us know that very shortly we are coming up what we call BBSN Connect, bbsnconnect.com. It's just a platform where when people need blood, they can go to that platform and they'll be able to access all the private blood banks, see what they have at the moment, and then be able to see where best they can get the blood. We have had cases where in emergency where they need O negative, and they call us from the Lagos State Blood Transfusion Services, and we can network our people in a very short time. And each time they call, we are able to meet up the demands of those that need especially O negative blood. That's one of the areas. And also we are coming up with what we call part of our corporate social responsibility to ensure that blood is available for especially the less privileged. Shortly we'll come up with that plan, and where our members will monthly be donating blood, giving blood, at least 1 pint of blood. And then we are planning now, how do we make sure that people that need it are given to free of charge? So that's to let you know that we are actually making some moves, and we will be ready to collaborate with the Lagos State Blood Transfusion Services. We'll be ready to collaborate with the Lagos State government to ensure that blood is available at all times. So I want to encourage that. I appreciate so much what the government have been doing, but we are just saying that they should keep in mind that we are there. If we are called upon, we will always respond to it. So thank you very much. We deeply appreciate this privilege, and God bless you all.
Thank you very much. The president, our chairman of the Blood Bank Society of Nigeria. First of all, I would like to let you know that we do appreciate you. You are very important to us. The majority of the blood in Lagos State is being donated through the Blood Bank Society of Nigeria. That is the private consortium of private blood bankers in the state. We need to appreciate the quality services that you give. We appreciate the timely services too that you give. We also look forward to our BBSN Connect. It would be very nice to have such a platform in the state, especially when this dear emergency need for blood continues. We have come to the end of this program. I am very honored to have you all wait till the end. The registration, we had over 500 people registered into this program, and at each point in time, we had a maximum of about 200 attendees. We understand that Tuesday is a very busy day for many people, but you have taken your time out to be here at least each part. Some people came here for just a few minutes to listen to part of the presentation or the other. So we would like you to know that all presentations will be sent to you. The recording of this webinar will be sent to you, as well as your certificates. Before the end of this, I would give special thanks to Professor Fabanwo, our father in the house, the Chief Medical Director of the Lagos State University Teaching Hospital. Is a great man. He encourages us, and is also a man that is known for quality services. He does not joke with quality. We thank also Dr. Latinji, she our retired permanent secretary of health, that was here with us all through. We really appreciate your presence here, Ma. We also appreciate Dr. Yugoda Saleh, a colleague of mine, all the way from Gombe State. Congratulations on your new appointment as the provost of the basic medical sciences, I think, yes. So we thank you, Lord. Thank you for being here with us and being a part of this particular program. We appreciate everybody that remained here. Thank you very much. And we will see on another webinar by this time next year. Look out for the Lagos State Blood Transfusion Service workshop coming up on disaster preparedness drills, and number 2 on trainings on cross-matching. Have a lovely week and God bless.